Hello and welcome to Health Dialogues. I'm Anshika Mishra. And when we talk about mental health, people often associate it only with stress and sadness. In reality, it's a complex science connected to our brain, emotions, and overall well-being. Now, in today's fast-paced life, we often ignore our emotional health while juggling work, expectations, and social pressures. The result? Rising cases of anxiety, burnout, and depression. Now, Dr. Nand Kumar, professor at the Department of Psychiatry, AIIMS New Delhi, has been working in the fields of neurobiology, neuropsychiatry, and the Bio-Psychosocial Model. He believes that to truly understand the mind and mental health, we must look beyond biology and also consider social and psychological factors. Let's explore some key questions related to mental well-being and their answers. So the first question is, how would one define mental health, and at what point does normal emotion turn into mental illness?
So let us first understand what mental health is. So mental health is basically our normal feeling, emotions, perception and related behavior. That's mental health. And we all have feeling, we all have emotions, we all have our perception, we all have good or bad feeling. That means if you have the feeling, you have the mental health. So if you don't have mental health, that means you are away from all feeling, emotions, good or bad. Now, why it is normal? Feeling is a normal, emotion is a normal. But just like physical health, like blood pressure is a normal. Blood pressure has a range. Kidney function has a range. Blood urea has a range. So similarly, emotion has a range. Feeling has a range. I'm feeling good. I'm feeling bad. I'm feeling terrible. But these all feelings are normal. Blood pressure 110 by 70 is normal. 120 by 80 is normal. 130 by 90 also normal. At times it shoots up. It shoots up to 160 by 100 for some time, normal. If you are walking fast, it becomes blood pressure is raised. That's normal. So similarly, it happens to our feeling, emotion also. If you are in good mood, it's fine. If you are in a bad mood, something bad is happening, then you are feeling bad. You are feeling low, or you are feeling angry, feeling irritated. So that is also normal. But when, just like physical health, this normalcy start affecting your function. Say for example, you are irritated all the time. You are emotional all the time, you are feeling low all the time, and it is affecting your work. As a journalist, you are not able to work. As a doctor, I am not able to see the patient. I am not able to do my work. Then it becomes a disorder. So then the concept of mental illness comes, or mental health issue comes. So mental health is basically normal coping mechanism that we follow on day-to-day basis. So it's nothing like black and white कि आप mentally healthy हो कि mentally healthy नहीं हो. It's a dynamic. Just like physical health is dynamic. Like कभी आपका सर भारी होता है, कभी आपके बदन में थोड़ा सा दर्द होता है, कभी पेट ठीक नहीं रहता है, कभी गड़बड़ रहता है. It is like that. So you cannot differentiate कि ये mentally healthy है, healthy नहीं. Because it has a spectrum. Now coming to mental illness. So any feeling, thought, emotion, action that lasts for longer time, certain specified time. Say for example, if you are having low mood with loss of interest, and if your mood is low, the interest is also lost in some activities, and then you are also disconnected, and you start feeling fatigue, you start feeling life is not worth living. For short time, it is normal. सपोज यू आर गेटिंग स्कोल्डेड, किसी ने डांट दिया आपको, तो शॉर्ट टाइम के लिए ऐसा होता है नॉर्मल. बट इफ इट लास्ट फॉर लॉन्गर टाइम, फॉर एटलीस्ट 2 weeks, 3 weeks, देन इट बिकम डिप्रेशन. सो दैट मीन्स कि इवन द लो मूड इज नॉर्मल. सो देयर इज अ continuum of mental health and leading to mental health issue and then illness. So if we go by this concept, the acceptance could be easier. But unfortunately, we have focused only on the ugly part of mental illness. If you are mentally not healthy, That means you are running around, you are running in a very bad shape, and you are running away from the home, you are naked, and you are socially completely unfit. So, in this context, perhaps we need to understand the mental health issues, and mental illness. Now, mental illness is a set category that is designed by the International System of Classification, like DSM, ICD. Say, for example, you feel like a fever, बुखार जैसा लग रहा है और बुखार हो जाना, दोनों में अंतर हो जाता है. I'm not feeling well, but then I'm not feeling at all well for some time. Say, for example, I'm feeling very happy. I'm feeling too happy, and there is no reason also. And that happiness, out of that happiness, my confidence is very high. And I feel that I can do anything. And because of that, I lost my sleep also. मुझे नींद भी नहीं आ रही है, मैं बहुत पैसे खर्च कर रहा हूँ, घूम रहा हूँ, कुछ भी बोल दे रहा हूँ. So then too much of happiness will also become illness. Too much of sadness also become illness. Some sort of suspicion is there, it's a normal. But too much of suspicion that affects your work, that is also illness. So in this context, the World Classification System, as DSM, ICD, they have categorized some set of emotion as an illness. And those illnesses are like depression, like anxiety, bipolar, schizophrenia, PTSD, adjustment disorder, so many illnesses in fact. So, but if you look at that little seriously, it's all extension of normalcy. It's all extension of normalcy. Suspicion is a normal emotion also. That saves us. Happiness is normal emotion also, but too much happiness is dangerous. Mood, too much of low mood is also illness. So the all illnesses are basically extension of normal emotion and feeling. But how we categorize that? If any emotion, any feeling leads to disruption in our activity, we are not able to do our design, our accountable action, then that may be considered as an illness.
Second question would be, despite having more psychiatrists and psychologists in India today, why are suicide rates still going up?
Now, if you look at recently, so we have been working on mental health since long time. Say, for example, suicide. Rate of suicide is increasing. In 2016, number of psychiatrists were 7,000. Now we have 11,000 plus psychiatrists. And population is not also increasing that fast. But still suicide is increasing. And we have a highest suicide rate in 2022. That means 1,75,000 people died by suicide as per the data available. So, 1,75,000 people died by suicide in 2022. That means COVID immediately baad. So, what does it mean? That we have increasing number of psychiatrists, more number of psychologists. We are spending huge amount on mental health also, but still the problem is rising. चीज़ें कम नहीं हो रही है तो बढ़ रही है. हमारे पास एक साइकोलॉजिस्ट है. आप देखें तो जैसे स्कूल के इश्यूज हैं वो बढ़ते जा रहे हैं. नॉट इन इंडिया, इन द यूएस ऑल्सो. वहाँ भी स्कूल में शूटिंग होता है, यहाँ भी सुसाइड अधिक होता है बच्चों में. अभी रिसेंटली सेंट कोलम्बस स्कूल में एक बच्चे ने सुसाइड किया. रोहिणी में कहीं पे गुड़गांव में एक स्कूल में सुसाइड हुआ. सो व्हाट डज इट मीन? It means that we are missing something somewhere. So then we started working on the mental wellness concept. It's not mental health only, concept of well-being. And when we realized it is not only just the mind, because mind does not work in isolation. Mind also always works with the environment. It's a composite health. So well-being means it's not only just mental health, it's a mental health, physical health, economy, environment, everything matters, and all these are determinants of mental health. That means our emotion. So if you correct one thing, if you increase number of psychiatrists, so that can address a small part. But if you try to improve other thing also, then that can actually take care of mental health of the entire community or country. So we need to work in some different way. We need to work on the wellness, and that includes the huge area that goes beyond the medicine, that goes beyond psychiatric consultation. Of course, if needed, psychiatric consultation is must. You must have the psychiatric consultation, must have the psychological counseling. But for that, awareness is needed.
The third question is, what exactly do we mean by the treatment gap in mental health, and how serious is it in India?
Another aspect of mental health problem is the treatment gap. The treatment gap means 70 to 90% people who are having the problem of mental health problem, they don't seek treatment. 70 to 90%, that's a huge number. And the reason is unawareness, poor awareness, stigma, then lack of mental health professionals. Mental health professionals, lack of psychiatrists, psychologists, doctors, counselors. But this is perhaps no less significant, because we have seen suicide happening in also medical colleges. So that means the professionals are there, but people are not going. That means the main issue is the awareness. You are not aware that whatever you are having is illness, or whatever you are having is a treatable condition. Say for example, I am feeling very much depressed because of any reason, and that depression I attribute to my environment, like my friends, my family, my society. So I will never ever feel that this is me having the problem. I will always attribute this to my family, my society, and others. Then I will not seek treatment. But if I realize that I am not feeling good, even I am being tortured by my family also, my friends also, workplace also, but still I'm not, I can take care of myself. And lot of ways and means are there. Say for example, I'm being tortured in this particular room. So torture means what? My senses are being tortured. I'm being abused verbally by you. I'm bullied by you. So if I change the environment, I can change my sensory perception. So that can be done. But at that point of time, you are not aware because you attribute to others. So the most important component for not seeking treatment is the awareness. Once you are aware, then perhaps a lot of things can be managed. Consultation, the wellness approach, the yoga, the sensory replacement, we can do a lot of things in fact. Then of course, the doctors, psychiatrists, psychologists, that the government is doing, number of seats are there, creating. Then the other wellness activities, like participating in some social activity, festival, culture, lot of things are there. And it used to happen earlier, but now we have shut down that because of so many reasons, because of so-called chasing the time, chasing the goal. And one beautiful concept was there, like collectively communicating or gossiping. That was kind of ventilation. But now we have adopted the concept of time should not be wasted. But it's not time waste, in fact. If you communicate with someone, it's a wastage of time not there. You basically utilize that. So even in the National Economic Survey, now they are focusing on mental well-being, not only on mental health. So we need to change the approach. And actually, if you want to work on mental health genuinely, that we have to start from the beginning. That means we have to start from the school. We have to start changing the perception, awareness from there, and we need to focus on well-being. Then mental health becomes part of this, not only on mental health. Then we need to focus on the awareness. If you're able to do this, the addressing the kids at school level in terms of the well-being, and for adults in terms of the screening, proper screening, scientific screening, perhaps we can address a lot of issues of mental health.
For the fourth question, how does India's psychiatrist to population ratio compared with the WHO's recommendation?
साइकियाट्रिस्ट का गैप कितना है सर, कितना होना चाहिए और कितना है?
साइकियाट्रिस्ट का गैप ऐसे देखें तो हमारे कंट्री में है पॉइंट होना चाहिए 1 साइकियाट्रिस्ट पर 1 लाख। WHO बोलता है 3 होना चाहिए तो पर 1 लाख, हमारे यहाँ 0.76 पर 1 लाख। सो सर्टेनली साइकियाट्रिस्ट का नंबर बहुत कम है। दूसरा ये है कि साइकियाट्रिस्ट का जो डिस्ट्रीब्यूशन है वो भी बड़ा अनइक्वल है। फॉर एग्जांपल दिल्ली में आपको मिल जाएंगे 200, अरुणाचल प्रदेश में आपको मिलेंगे 3, गुवाहाटी मिलेंगे 20, गोवा मिलेंगे 10। तो डिस्ट्रीब्यूशन काफ़ी अनइक्वल है। अगर स्टेट के अंदर देखा जाए तो यूपी में मिलेंगे अलग अलग जगह पे। इस यूपी के इतने बड़े स्टेट में किसी जगह पे आपको किसी डिस्ट्रिक्ट में 1 ही नहीं है, किसी डिस्ट्रिक्ट में 4 हैं। तो जितना अर्बन एरिया है वहाँ पे कॉन्सेंट्रेशन अधिक है और इससे कॉस्ट ऑफ ट्रीटमेंट बहुत बढ़ जाता है। जैसे मान लीजिए अगर यूपी में किसी को जाना है दिखाने के लिए साइकियाट्रिस्ट को 100 किलोमीटर, तो 100 किलोमीटर का आपको जोड़ना पड़ेगा भाड़ा, आना जाना प्लस खाना रहना प्लस कंसल्टेशन प्लस दवाइयाँ। तो इस तरह ट्रीटमेंट बहुत महंगा हो जाता है। तो उसके लिए उसको इस गैप को ब्रिज करने के लिए लोगों ने शुरू किया है डिजिटल मेंटल हेल्थ या हाइब्रिड मोड ऑफ मेंटल हेल्थ केयर।
The next question would be, what were the key findings of the National Mental Health Survey conducted in 2016?
स्टेट-वाइज कोई डेमोग्राफी है कि पेशेंट कितने किस स्टेट से ज़्यादा है, कोई डेमोग्राफी की मेंटल हेल्थ है?
स्टेट में डेमोग्राफी है। जो नेशनल मेंटल हेल्थ सर्वे भी हुआ था 2016 में, जो एनहांस बेंगलोर ने किया था, उसमें उस डेमोग्राफी में ऑलमोस्ट हर स्टेट का जो लेवल है नेशनल आया है 13.6% लाइफ टाइम प्रेवलेंस, लेकिन किसी स्टेट का 13 है, किसी का 10 है, किसी का 6 है। बट उन्होंने जो फोकस किया है वो बोला है कि बराबर है मोटा मोटी, एक्सेप्ट द सुसाइड, बिकॉज सुसाइड का डेटा सबसे अधिक रॉबस्ट है। और उस रॉबस्ट डेटा में देखा गया है कि सुसाइड सबसे अधिक जो स्टेट में होता है आपका पौंडीचेरी, केरला, महाराष्ट्र, देन और लेकिन सुसाइड का रेट लो है झारखंड, यूपी में बढ़ गया है, झारखंड, बिहार। सो इट इज़ वेरी इंटरेस्टिंग कि जो लो लिटरेसी एरिया है वहाँ सुसाइड थोड़ा कम है। जो लिटरेसी जहाँ पे अधिक है वहाँ पे फ्रेगमेंटेशन भी अधिक है, आइसोलेशन अधिक है।
Moving to the sixth question. Why do we see higher suicide rates in states with higher literacy levels like Kerala or Pondicherry?
देश में सबसे ज़्यादा मेडिकल कॉलेज पौंडीचेरी में है।
यस, तो वहाँ का सुसाइड रेट काफ़ी अधिक है।
तो सर
अभी
एजुकेशन से मतलब जितना भी है, दैट मींस वी आर आइसोलेटिंग आवरसेल्फ
अप टू सम एक्सटेंट मैम, यस। इसलिए कि द सोशल बॉन्डिंग डिक्रीजेस विद एजुकेशन, द सोशल कनेक्ट गेट अटेन्यूएटेड with high literacy education, because then you are taught to live independent, autonomous. Say for example, suicide is less in Bihar because social support is still much better. Suppose if something happens to me, अगर मुझे कुछ हो रहा है तो मेरा ब्रदर मेरे से बात नहीं भी कर रहा है तो मुझे खाने के लिए बोलेगा चलो खाना खा लो, बाद में गुस्सा करना। No, the same thing happened to farmer also. The farmer suicide is much less in UP, Bihar, Jharkhand, Madhya Pradesh. Then the south, Andhra Pradesh में अधिक है, तमिलनाडु में अधिक है, because when the aspiration becomes high, नहीं, say for example the crop production is less here in UP, Bihar, Jharkhand, and they are happy with that. But once you start increasing the crop production, बढ़ाना चाहते हैं आप अपना क्रॉप, So then you start taking loan also. Then your pressure increases. And if there is a loss, then you are not able to handle. That loss can't be compensated. It's difficult to compensate. But this loss can be compensated. If the crop is not good quality, you can be helped out. Here, जहाँ loan नहीं है. So the literacy has no something to do, because Kerala highest literacy rate, suicide is high, because then perhaps we are isolated.
Moving to the next question. Could it be that literate states show higher suicide rates simply because of better reporting system?
लेकिन डॉक्टर ये भी तो रीजन हो सकता है कि बिकॉज दीज ऑल आर हाई लिटरेसी स्टेट्स, तो यहाँ पर रिपोर्टिंग ज़्यादा होती होगी, और जो ये जो वाले सारे बीमारू स्टेट्स हो यहाँ पर रिपोर्टिंग कम होती है. ये भी
रीजन हो सकता है ना, but that depends on the reporting system. If you look at reporting system, the reporting system is FIR based. It's not an agency. It's not some particular agency of the government that do the reporting. So it's all FIR based. तो FIR तो हर जगह की पुलिस करेगी ही करेगी. It's usual, no? It's not कि आपको सुसाइड का और करवाना है, because people avoid reporting suicide because lot of problems are there. No, not only stigma, no? There is a financial loss also. If you are insured and if you die by suicide, you will not get the insurance money. So that is a major issue. So reporting system, you are right, but most likely it may not be the factor because it is done by the police, FIR. But this is also unfortunate. We should have some sort of better reporting so that we can have better data, because still it is a crime. If the police is involved somewhere, it's a criminal activity.
Moving to the next question. Can emotional relationships between a husband and a wife also have an impact on their physical health?
सर, पति और पत्नी के बीच जो भावनात्मक रिश्ते बिगड़ते हैं, उसका असर क्या उनके फिजिकल हेल्थ पे भी होता है?
Certainly होता है. Whatever happens, जो भी कुछ दिमाग में होता है, उसका असर बॉडी में पड़ता है. जैसे हम लोग बोलते हैं स्ट्रेस, तो जब भी स्ट्रेस होता है तो स्ट्रेस ब्रेन का हमेशा ट्रांसलेट होता है बॉडी में, जैसे बॉडी का स्ट्रेस ट्रांसलेट होता है ब्रेन में, तो होता है. और स्ट्रेस से अगर स्ट्रेस लंबा चले, क्रॉनिक चले, तो बीमारी कोई भी हो सकती है. कोई भी का मतलब होता है ब्लड प्रेशर हो सकता है, डायबिटीज़ हो सकता है, ओबेसिटी हो सकता है, अस्थमा हो सकता है, आपका जो फर्टिलिटी है वो हो सकता खराब हो सकता, पुअर क्वालिटी का हो सकता है, आपको डिप्रेशन हो सकता है, एडजस्टमेंट इशू हो सकता है, नींद कम आ सकती है. तो स्ट्रेस कैन लीड टू एनी मेडिकल कंडीशन इन द लॉन्ग रन, अगर आप उसको मैनेज नहीं कर पाते हैं तो. इसलिए हम लोग कहते हैं कि द बोथ आर वेरी इंटीग्रेटेड. यू कैन नॉट सेपरेट बॉडी एंड द माइंड, बट अनफॉर्चुनेटली हमने सेपरेट किया इसको शुरू से, इसलिए जो भी होता है.
Moving to the next question. Is there scientific evidence that directly links stress to physical diseases?
क्या उसका कोई डेटा वगैरह भी आप लोगों ने किया है, देखा, या वर्ल्ड वाइड अगर कुछ हो?
डेटा वैसे डेटा स्कैटर्ड है. कारण क्या है, इसको स्टडी करना इतना आसान नहीं होता है. जैसे मान लीजिए स्ट्रेस, अब कितना स्ट्रेस किसको फ़र्क पड़ रहा है, इसमें बहुत लॉन्ग टर्म स्टडी चाहिए. जैसे मान लीजिए अगर मैं एक पर्टिकुलर कंडीशन में हूँ, अगर मेरी वाइफ से मेरी नहीं बन रही है, तो वो हमेशा बनना कंसिस्टेंट नहीं होता है. आज बनी, कल नहीं बनी, परसों थोड़ी सी बन गई, दरसों और ख़राब हो गई. सो ये डायनामिक होता है ऐसे, इसलिए इसको स्टडी करना बहुत आसान नहीं होता है. बट ये वेल प्रूवन है ह्यूमन स्टडी से लेकर स्टडी तक कि जब भी स्ट्रेस होता है तो इट कैन अफेक्ट एनी ऑर्गन ऑफ द बॉडी.
For the last question, do you think mental health awareness should begin early, perhaps right from school, or is AIIMS working on any specific initiative to promote mental health and emotional well-being among school students?
सर, ये जो स्कूल चिल्ड्रन से शुरू होना चाहिए अवेयरनेस, उसके लिए एम्स कुछ इनिशिएटिव ले रहा है लाइक ऐसा?
हाँ, एम्स ने इनिशिएटिव उसके लिए लिया है. एंड हम लोग CBSE के साथ मिलके एक कर रहे हैं प्रोजेक्ट, क्लास 5, 6, 7 से शुरू कर रहे हैं उसको. इसका नाम हम लोग ने दिया है मेट. मेट इज अ कॉम्बिनेशन ऑफ हेल्थ एंड एजुकेशन. इसलिए कि हम लोग ऐसा मानते हैं कि अगर आपको हेल्थ पे काम करना है तो हेल्थ ऑफ नेशन can be built up only from the school and community, not in the hospital. Hospital for illness, So the AIIMS is very proudly doing that. We are working on health also, so that we can contribute in the community health. So we are working in the schools with CBSE, and we have done some work in Meghalaya also. Now CBSE has given us 50 schools in Delhi NCR to implement this project MATE. This project MATE is basically to enhance resilience. We are not focusing on mental health. This is the project for the well-being. Well-being का मतलब होता है तो physical, emotional, social, सब कुछ. So it's a comprehensive. It's not mental health. It's a component of mental health. और उसके लिए हम लोग ट्रेन कर रहे हैं जो स्कूल के काउंसलर्स हैं उनको हम लोग ट्रेन करते हैं एम्स में 5 days का ट्रेनिंग होता है फिर उनको अपने स्कूल भेजते हैं वो बच्चों को वर्कशॉप करवाते हैं मेट प्रोजेक्ट का फिर हम लोग उसका असेसमेंट करते हैं और फिर हम लोग प्लान करते हैं कि आगे क्या उनको हेल्प कर सकें।
ये 50 स्कूल्स सर अभी दिए हैं दिल्ली एनसीआर में?
हाँ 9 में हमारा चल रहा है अभी 9 में चल रहा है 50 हम लोग शुरू करेंगे अप्रैल से नेक्स्ट सेशन से
नेक्स्ट नाउ मोर 50 मोर
राइट।
मेघालय में आप लोग
नहीं इसमें स्क्रीनिंग इसलिए नहीं होगी इसमें स्क्रीनिंग ऑटोमेटिक है जैसे हम लोग वाला फोकस नहीं कर रहे हैं कि बच्चों को हम जो बच्चे इलनेस हैं उनको निकालें इट्स नॉट लाइक दैट इट्स अ वेरी जनरल वी आर वर्किंग ऑन ऑल द चिल्ड्रेन इसलिए कि मेंटल हेल्थ या जो वेलबींग होता है इट्स नॉट इन ब्लैक एंड वाइट इट्स इन द पीक से फॉर एग्जांपल आई एम मेंटली हेल्दी और माय वेलबींग इज फाइन आई कैन बी बेटर देन दिस सो दैट्स अ पीक अगर आप आज ठीक है आप और भी अच्छे हो सकते हैं सो वी आर वर्किंग ऑन दैट कंसेप्ट सो इट्स अ नॉट स्क्रीनिंग इट्स अ डूइंग द वर्कशॉप टू इनहेंस द रेजिलियंस बिकॉज काउंसलिंग अगर आप एक बार करते हैं तो कोई पर्टिकुलर इशू के लिए करते हैं अगर आप रेजिलियंस डेवलप करते हैं तो लाइफ में कोई भी समस्या आए आप उसको हैंडल कर सकते हैं।
Thank you, Dr. Nand Kumar, for shedding light on the often overlooked aspect of mental and emotional well-being. Your expertise has highlighted the importance of prioritizing mental health in today's fast-paced world. Now, Dr. Nand Kumar's insights emphasize that mental well-being is just as crucial as physical health. By acknowledging and addressing our emotional needs, we can lead more balanced and fulfilling lives. We appreciate your time and valuable contribution to this important discussion. Thank you so much for watching and stay tuned to Health Dialogues for more updates.